And I think that this is why a lot of women don't hear the bad stuff, because you have way more time in the sweet spot than you do in the acute phase. And so after he had the tongue tie release, like I said, it wasn't 100% right away, but it was never as bad as it was. That was the worst. And then the tongue tie release did help. And then it kept kind of getting better from there.
Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 105. On today's show, you will hear Lisa talk about her breastfeeding experiences, which really did take her by surprise. She admits to being somewhat judgy about other moms who quit breastfeeding because they said it hurt too much or it just wasn't working out. Well, all it took was 36 hours after her birth to erase her judgmental attitude. Since she planned to home birth and enjoyed a water birth with her first son with no intervention, she expected her breastfeeding experience to be as natural as her birth was. She was shocked to experience painful breastfeeding, and by the time her baby boy was 36 hours old, she was already contemplating bottle feeding him formula because her pain level was so high. Lisa talks about how bad things were before receiving the proper help and how much better breastfeeding became in a relatively short period of time. Lisa is a fertility awareness educator, and she's going to give some great information on how you, breastfeeding moms, can use the fertility awareness method to use as an effective method as birth control or when planning on conceiving. Welcome to All About Breastfeeding, the place where the girls hang out. I am Lori Jill Eisenstadt, your host and IBCLC. Today, I would love to welcome Lisa. She is a fertility awareness educator who has been charting her own menstrual cycles using the fertility awareness method for the past 15 years. She is passionate about helping women to develop body literacy by understanding their natural cycles. Lisa is also the founder of FertilityFriday.com and the Fertility Friday Podcast, which is a weekly radio show that she created to connect women with a deeper understanding of how fertility and overall health are connected and intertwined with menstrual cycle health. Each week, she conducts in-depth interviews with professionals who specialize in helping women to restore their fertility naturally. Lisa Hendrickson-Jack, I would love to welcome you to the All About Breastfeeding show.
Thank you so much, Lori. Great to be here.
We have met from being in an online group together. And man, when I saw the name of your podcast, sometimes when we're setting up our names for podcasts, sometimes it's hard to figure out a name and you want to name it something that as soon as people look at it, they'll know. And when I saw your name, I thought, now that could not be any more perfect. So I love Fertility Friday. I've also got turned on to your show. I've turned my daughters onto it. I sent them a couple of your shows. We'll get into it, but I know you just did your 100th show, 2 of them, and I sent them both of those shows. We'll talk about that more, but I thought that it was very creative and a very positive way to introduce new people to your show. So I really love that. So thank you so much for spending time hanging out with me today. If you could tell a little bit about yourself, what life was like in the family that you grew up in, our listeners can get to know a little bit about the personal side of you.
Well, thanks so much, Lori. It's really sweet of you that you shared my podcast. I think that that's the biggest compliment that anyone can give. And so the bio gives quite a bit of background. Ultimately, I'm really passionate about women's health. And the reason that I started my podcast is because I believe that every woman has the right to know the very basic information about her menstrual cycle. And for some reason in our culture, we're not privy to it. And ultimately, I guess one of the most common things I hear when women reach out to me after they found my podcast is it's either, why didn't anyone ever tell me this? Or I wish I would have found your podcast 20 years ago. So that's a little bit of background about me. I'm super passionate about talking about vaginas. So I think it's so fitting that you love talking about breastfeeding. And so we're just, handling all the anatomy in one spot here today.
I have a couple of fun names for, you just said vagina. So I don't know if you ever watched that Grey show years ago, but one of the characters called it a vajayjay. Did you ever hear that?
Vajayjay, yes.
Yeah, so I think that was Bailey, one of the characters. So I love calling it a vajayjay. And also years ago, it used to be referred to as a yoni, yoni. Have you ever heard that either?
Yeah, I could probably list a lot of. I should probably consider doing a spoof on your intro because your intro is awesome. But I guess to quickly answer your question, a little bit of background about my growing up. Thinking about it, I was, a happy kid. I had a happy childhood. I'm an only child. So I always joke that I had way too much attention from my mom and dad because it was just me. And I think that there were times when I was growing up, of course, when I would have wanted a sibling, and they tried. So, they did try, but unfortunately they weren't able to have another child. But yeah, otherwise, I think having no other siblings and having a lot of, I guess, alone time, it definitely gave me, I think about the way I am now and just the way I'm able to kind of go and do my own thing. If I have an idea, I just kind of run with it. And that probably comes with just having to entertain myself as I was growing up.
Did you know that you were needing to entertain yourself? Like, did you know that, I am an only child. There are other people who have siblings and they keep each other busy and have people to hang out and play with? Or is it as you've gone through adulthood, you look back and you're like, yeah, I definitely was an only child. And that's why I am the way I am with certain things.
Oh, I definitely knew because now that I have, so my eldest son is just about to turn 4 here. And so I can kind of remember being around that age. So it's interesting now being a parent, but I would have been asking for a sibling all the time. Like I wanted a sibling. I used to fantasize about having a twin because I actually have older cousins that are twins. And so I did know. And I wouldn't say that it was a negative experience, but I would say that I knew it and I always kind of wanted more people around. So it's kind of fitting that I created a podcast to surround myself with a community, right?
Yes, yeah. It's interesting. And like you said, you definitely knew it. I just kind of went with the flow. There are 5 kids in my family. I'm in the middle child. So it's not anything I ever really thought about. And most of the neighborhood kids I grew up with, almost everybody had siblings except for one woman. We'll just call her Susie Smith. And it was always, everybody just knew that Susie Smith was an only child. I want to talk about what you're currently doing, but I'm always interested, and I get some pretty interesting answers. When you were young and growing up in your late teens, early 20s, is there anything about what you are currently doing with your podcast, with your career, that you thought about when you were in your late teens and early 20s and thought you would be doing anything along this line of work?
Well, I guess in some ways, yes. So I can definitely pinpoint what I'm doing now. It's definitely impacted by some of the experiences I had as a teenager. And as a teenager, when I had my first menstruation, from then it was super painful and heavy. My experience of menstruation as a teenager was it was always painful from the very first one. I always had to take medication, and I was a really active teenager. I was playing basketball and volleyball and track team. And I also did ballet. So I was pretty active physically. And so at some point, I guess all women kind of know, even though I'm not a child of the internet. So I grew up in the 90s. And so I didn't have the stuff that they have now, all the knowledge and information at your fingertips. I didn't have that, but I knew enough to know that I could just go to the doctor and ask for birth control. So really, I went to the doctor. I got my mom to take me to the doctor when I was 15 or 16 or something like that. And then I literally just said, my periods really hurt and they're heavy. And the doctor was already writing a prescription for the pill. So So I remember then I was on the pill, but I wasn't actually using it for birth control. And he would always kind of bug me about it. Like, are you going to be on that forever? Like in my house, it wasn't just considered to be like this normal thing to be on it. And I think that rubbed off on me because when I actually did need birth control, a couple years down the road, when I was actually I was in a relationship with someone and I couldn't actually trust the pill. And I also knew that I wanted children someday. My mom had fibroids and she had a hysterectomy when I was, I don't know, maybe 10 or something. And my aunt had a hysterectomy too. And my other aunt had a super hard time getting pregnant. So I knew that this could be an issue for me. And as a result of that, I also knew that the pill wasn't fixing my painful periods or anything. So even this is age 18, so this is insight for a young person, but I knew that it wasn't fixing it. And I knew that if I wanted kids someday, I should really try to figure it out.
You started taking the pill when you were 15. So I'm curious, you say by 18, you already knew that it wasn't helping you. That was their answer for the pain, the heavy bleeding and the painful periods. And you're taking it for 3 years. It sounds like you're probably getting it renewed every year.
I kind of went off a couple times in there. And every time I stopped taking it, I would always come back like the same or worse. Like I knew it was not actually fixing it because then when I went off of it, it was a real period. Because when you're on it, you don't really get a real period. You get like a little fake period.
And then I heard you say that you knew that you were in a relationship and you wanted protection, but you also, I think I heard you say you knew that you couldn't count on the pill. So I was curious about that statement.
Yeah, I feel like I'm kind of the weirdo in the world to say that. Because I was on it as a teenager and because I was not on it for birth control and because I'm a super nerd. And so I actually read the inserts. Like if I'm taking this thing, I actually read the whole thing and whatever. And I knew that it said in the insert that you have to take it at the same time every day. And I never did because I wasn't using it for birth control. So I literally never followed the instructions because that wasn't why I was taking it. And as a result and I had read the book and it said, if you don't take it at the same time, or if you miss one, you have to do this and that and the other thing. And so I just knew that for me, it just wouldn't work. And also because I wouldn't know that whole idea that you could be pregnant for like a month while you're still taking this thing before you knew. I couldn't deal with that.
Okay, so now you explained it a little bit more deeper, so now I understand it. When you just said that and you just kind of put it out there and didn't explain yourself, I was like, that didn't make sense to me. But now I think we totally get it. We're going to get more into, maybe not necessarily into your specific menstrual cycle life, although you might need to talk to us about how it led into the work that you're doing, but we're going to come back to that. For a few minutes, I would like to talk a little bit about breastfeeding because I know you're a mom, you have a couple of kids, and you breastfed. So I'm always interested to know from mothers what your thoughts were about breastfeeding when you were pregnant and what, if anything, you did to prepare for the time that you would be breastfeeding for the first time?
That's a really interesting question. So when I was pregnant, I already knew that breastfeeding was important to me. I had planned to breastfeed. I think sometimes I hear women talking about how long they intend to. I didn't really have anything that specific. I knew that I would kind of go until it felt like it was time to not. The one thing I'll say is I didn't think that it would be an issue. And I remember on my high horse, I don't know, we all have our little inner judgy person before we have kids, I think. And then having children rectifies that real quick.
Oh, real quick. Takes
real
care
quick,
of
yeah.
that real quick.
Yep. And so one of my inner judgy things was that, if a woman stops breastfeeding, she's just not trying hard enough or that kind of stuff. And so my experience of breastfeeding rectified me of that. I fully understand now why women struggle and why sometimes it just doesn't work.
Is that because you had some struggles yourself?
Yeah, no, absolutely. So I'll put this into perspective for the listeners as well. My son was born in his bedroom in water. So I'm one of those women who's trying to do things kind of as naturally as possible. I was really not wanting, it was like my biggest fear. I'm more scared of the whole surgery thing. I was afraid of a C-section. So I thought, okay, so if I go kind of as far in the other direction as possible, that I I'm less likely to need that. So that's just a little bit of background. So for me, breastfeeding, I thought was going to be just this natural thing.
Did you plan a home birth?
I did, yeah. So it was planned. I had a midwife. It was, yeah. So that's just like, so I didn't think breastfeeding would be a problem for me. So, then I have my son and, he did latch right away and he was eating and the midwife said, oh, it's great or whatever. But within the first 36 hours, it got to the point that it was so painful for me. Every time he latched, it felt like razor blades on my nipples. It was so excruciatingly painful. There were times when he would latch and I would scream. And within the first 36 hours, I kind of broke down. It hurt too much for me to put him to the breast. He was screaming. He's so hungry because obviously that's just how it is when, he's bringing in the milk, right? And so when babies are bringing in the milk, they're sucking and sucking and sucking and sucking. And oh my goodness. So I actually broke down and gave him some formula and I lost my mind. I'm like crying. And my husband's at the time, like he has a different perspective on it now, but back then he kind of didn't get like what my problem was. He's like, formula is the same. His experience, I'm pretty sure he had formula and like he just was starting to see me in so much pain. So he just wanted to kind of end that. So it was this hot mess. And I felt like I was, like abusing my child. You know how like, cause you just gave birth, your hormones go all over the place. Like your progesterone levels go down, you just feel so raw and emotional. And then to top it off, to be in physical pain and then to have a screaming baby on top of it and a husband saying, just take the formula. So I remember then the following day, the midwife came and she saw the formula and she's like, what's going on? Because the midwives do a couple visits that first week. She's like, everything was great when I left. She's like, what happened? So basically the reason I was in such extraordinary pain was because my son had a tongue tie. And so, yeah, like he couldn't stick out his tongue all the way. So it was like right at that perfect spot to like needle your nipple so that it hurts so much that you can't even, the pain, I can't even explain how bad it hurt. It's unreal. So fortunately, I had support. It worked out really good for me. I had taken a prenatal class and the early beginnings nurse who taught the class, I was so like kind of desperate, in those moments where you're just like reaching out to anything. I sent her an email and I was like, do you know, because I was supposed to have somebody come to the house. Like, so I don't know if they do this everywhere. I'm not sure, all your listeners are in different countries. And so I don't know how that works, but I live in Canada. And so typically after you have a baby, there's a program, I think it's called like Early Beginnings or Healthy Beginnings or something. And they send a nurse over to your house. And so I had emailed her just because I knew she did that program and just like, oh, could you send someone over? And she was like, oh, it just happens to be my day. So I'm going to come over and help you. So I had her as support. I had my midwives as support. I was given a referral to the Jack Newman Clinic. So I live in Toronto, Ontario. And Jack Newman, I'm sure you've probably talked about him on your show. He's like the breastfeeding doctor. I met him, like I went to his clinic here because I live here. And so his clinic is literally in the same city that I live in. And I was able to get in like right away. And so he did the tongue tie release where they like clip, the frenulum.
Now, Dr. Newman did that himself?
Yeah.
Used a scissor method?
Yeah.
Were you in the same room?
Oh, I had to be. I know some moms can't watch, but I was like, if I'm putting you through this procedure, I have to be there. And so they had me set up where, like the boob was out, ready to go. The nurse was there to help me latch. And so they cut the frenulum and then like, he's like screaming and crying. And then they like rushed him on the breast. So it was this like one fell swoop, like, and then I'm not going to say like it was not like 100% better right away, but it was definitely noticeably better right away. But it still took, several weeks to really like to get to that sweet spot where it's like putting on your shoes.
A lot of my regular listeners will already know that I've done many shows on tongue tie because it's before you get into the whole breastfeeding scene. If you're not working with babies and mothers in speech therapy and you don't have any family history or that you're knowledgeable about it, most parents have not even heard of tongue tie. So you're giving birth to this brand new, beautiful baby. And then if you're lucky enough to be diagnosed, especially in the early days, but it's still for most mothers, it's still pretty intense to hear something about something is quote unquote wrong with their baby's tongue and they need to clip the tongue and a lot of the words that are used. And here in the United States, we don't have a visiting nurse or a visiting midwife or anybody come to the house on a regular basis. If you have a baby that was very premature and have health issues and you get connected to those programs, then possibly, but otherwise you don't. So frequently it goes undiagnosed, sometimes for weeks and sometimes for months to get into a practitioner. Literally sometimes is not just a day or two, but it's weeks. So the reason I was asking you is because I think it's helpful information. And a lot of people are curious about, well, what happens in other countries? We know what happens here, but in other countries, sometimes it's diagnosed much quicker. You get into a clinic on the same day. Some places you can be with your baby if you want to. Other places, they do not want parents with them. Some places use a scissor, some cauterize that tissue, some use a laser. Goodness. And then sometimes the baby's pretty numb afterwards, so they don't go to the breast for a few hours. And sometimes they kind of reject the breast for a day or two while they're healing, depending upon the kind of procedure. So yeah, since you brought in tongue tie, just kind of wanted to bring that in. And again, I'll put in the show notes some of the shows that we've had about babies who are tongue tied. It can be the whole gamut between what happened with you and fairly soon diagnosis and getting to that clinic the same day and have it taken care of the same day too. Weeks before it's diagnosed and then weeks before you get in to get it taken care of and then weeks before it gets better. And I don't know what happened in your situation, but part of it is your baby wasn't using his tongue properly. And just because he had that tissue revised doesn't mean all of a sudden he's using it exactly well. But the other thing is that sometimes they're a little sore or your nipples have had such trauma though. So that may have been part of your healing process. Like maybe he was using his tongue a little better, maybe a lot better, but your nipples had been through so much in those first couple of days. It takes that while to get to, I call it that, that really happy place. And what did you say? You said something, you had another analogy.
I said just the sweet spot. I think what you said really struck me. I know that, so I don't want to give the impression that like everywhere in Canada is going to be like that. The reason that it was identified is because it just so happened that my midwife was familiar with it. She actually had said something about it kind of early on, like, oh, it looks like he might have a tongue tie. And so that was literally like minutes after his birth when she checked him. And that's one of the things she checked him for. So I wouldn't want to give the impression that every single place in Canada is that way, because my experience could have been very different if I didn't have that particular midwife. And even like how you described like having the possibility of having weeks. This goes back to my point earlier where I had that little mini judgment about, it's actually a pretty big judgment, that women who kind of struggle with breastfeeding or end up stopping quite early on or just not trying hard enough. I know for a fact that because I was in such pain, that if I hadn't had that support, I would probably have tried to figure out how to sort of make it work, but he would have had to have formula because it hurt that much.
Yeah. And if you're like a lot of us, did you say to yourself, like, man, I'll do that birth 5 times over, but this whole breastfeeding thing?
Well, the breastfeeding thing goes on forever. So what I say now is like labor has a beginning, a middle, and an end, and then it's over.
And very short term, 1-2 days, right? Breastfeeding.
But then breastfeeding, truthfully, it didn't get to that real sweet spot until 4 to 8 weeks. I think part of it, especially now that I've had 2 babies, I think my babies came out small too. So they were both 6-pounders. So my eldest was 6 pounds, 6 ounces, and then my youngest was 6 pounds, 12 ounces. And so their mouths are actually really small. So I looked up all the stuff about latching and how they're supposed to latch. But in my opinion, I'm not an expert. I don't have background in breastfeeding, but just as a mom, as soon as they get bigger, it doesn't hurt as much.
Yeah, there are many factors to that, but sometimes that's what happens with people is that the latch isn't that great. The baby isn't doing as good of a job. But if you somehow suffer and plod through it, at a certain point, your baby puts on 2 or 3 pounds, their oral cavity is bigger, and they can just get further back. and all of a sudden you realize that things are much better. So with your son, was there a point, we talked a little bit about it, like if this didn't change quickly, you might have given more formula. Maybe you would have figured it out. Maybe depending upon your pain, you might have given up. Was there a time when you remember that you were just like you vacillated about quitting and yet there was something that stopped you from doing so?
I would say that no, because I was pretty clear on it. Like I was like, I am going to breastfeed. This is going to happen. I wouldn't say that, but because I didn't get to a point where I wanted to quit at all. What I did experience was that I completely understood why women do. Because in my case, I had the knowledge that there were resources out there and I had support. I mean, my midwife was a really big resource for me. She was the one that told me about the Jack Newman Clinic. She was the one that identified the tongue tie, and she was the one that encouraged me and explained why that could be what's causing my pain. And if I didn't have that, and people were just trying to correct my latch without actually adjusting, because the other thing about both of my sons is that they're super good eaters. So you can imagine they're like on there, like super efficient, sucking so efficiently and hard, wrong. So just like shredding your breast. And they were gaining weight. Like my eldest son, he was gaining weight fine. And like the midwives were like, oh, wow, he's gaining so much weight. But meanwhile, I was just destroyed. Like it was just so painful for me. So I can't say that I had a point where I was going to give up, but I just feel really fortunate and blessed to be in a place where I had the support that I did, because if I didn't have that, it would have been a completely different story.
Right. And so, like you said, that judgy self, very quickly you realize why some women do give up. But like you're probably of the stubborn personality. You made up your mind. It's not happening. You had really good support. You had resources. But again, that judgy part comes back and you're like, what if I had this kind of pain and I didn't have the resources? Then you're looking at the other women who are giving up.
I wouldn't have. Because and I think, I could have used your podcast back then. But yeah, I mean, it hurts so much. And I keep saying that, I keep stressing it because I think that women, we don't know, like you just don't know. And I remember because when I was pregnant, the question you asked about, what I thought about breastfeeding, people would be like, oh, sometimes it hurts. You're kind of like, oh yeah, I can handle that. But you don't know what that means. And it's just women really need support, and it's really acute. You need support today. So what you said about how some women don't necessarily have access to support or even to the procedures that they need for weeks, that's completely unacceptable because it's such an acute thing. Your baby eats like 100 times a day when they're first born. Every 2 hours, every hour and a half, you have this excruciatingly painful experience. Like I would cry when he latched. I would scream. And I was walking around the house without a top. Like, so my breasts were so sore that I couldn't put a shirt on. And my in-laws came over and I'm not like a naked person. Like this is not a naked house. It was like that. Like it was so just real and raw and challenging. And I was walking around without a shirt because I couldn't put it on because it hurt too much to have a shirt on.
This is why even before when I said women give up, I think that they're in so much pain. It's really difficult to continue. And some women are doing themselves quite a bit of harm because the nipple tissue is eroding. So I really like to actually change that language. Like they didn't necessarily give up. Sometimes you just cannot keep doing it. And that is one of the reasons, that's one of my big mantras with this show, is that it's not supposed to hurt. And
exactly.
Anybody who's dealing with anything with breastfeeding that's hurting, what I want them to know is that's not normal, not the first latch, not the first day, not the first week. So pain is a sign that something is wrong and you really want to get it taken a look at. One of the things that I'm also curious about is you said that your husband, he kind of equated breastfeeding with formula feeding or breast milk with formula and didn't really think too much of the difference. But now he's got a wife who's suffering. She's crying. She's postpartum. There's probably, some anxiety or some stress or frustration. And he's seeing you, loving you, feeling for you. What were some of the things that was going on in your relationship with your husband, you're plotting through, you want to keep doing this. And what is he doing?
He's a fixer, like a lot of men. It's kind of like that men trait where they see a problem and they just naturally want to fix it. And so it's that whole kind of condescending stuff. So any woman who has breastfed and maybe not in 100% supportive environment has probably encountered the sentiment. And it just completely roused me up to think that in a hospital, nurses might be saying this stuff to women because they do. Oh, you don't have to be a hero and blah, blah, blah. So what you said about how it's not supposed to hurt and to understand that aspect of it, I feel like that is a big part of what helped me to seek the support that I needed. And it's because I was clear on that. I was clear on the fact that it wasn't supposed to hurt. And I knew that there was something wrong. So that meant that I knew that there was a solution. So I just had to find it. And I had to find the person that could give me the solution. And in my case, the Jack Newman Clinic, my experience there, they also supported me in terms of latching. So I think that's a really big thing if women don't know that it's not supposed to hurt.
I say that all the time. And as often as I say it on a regular basis, I still meet women who say, well, I thought it was supposed to hurt for 2 or 3 weeks or 5 weeks or 6 weeks. And now it's 6 weeks and it's still going on. So now I'm calling you, asking you for help. And I love that you just reiterated that it's not supposed to hurt. It means that something's wrong. And what I say is that we should be on a mission to figure out what's wrong. We need to be on a mission to fix this and not just kind of blow it off so easily and switch to pumping and bottle feeding or formula feeding, which people can do. But I just want them to know that there usually is a fix for breastfeeding, that it's not normal.
So what was going on there was, it was a clash. It was like the first parenting clash, right? 36 hours out of the gate and we clashed already, because it's kind of like when you discover something about your partner and you're like, oh my goodness, you don't think that breastfeeding is the only way? Like, this is a problem. From his perspective and from his experience, he just thought that formula and breast milk were basically the same. And fortunately for me, it kind of worked out. It kind of worked out in a way, like I didn't have to convince him. So before I surrendered, because it hurt so much, my son was eating or drinking breast milk. So for the first, 2 days, 2.5 days or whatever, he was having his bowel movements, like his meconium or whatever. And through, several times a day, like newborns poo like 2, 3, 4, 5, 6 times a day. And then we gave him the formula. And then he literally didn't pass stool for about 24 hours. Like, we were just new parents, super worried about everything. I was so stressed out all the time. There was it was a very just stressful experience for us, and especially with the breastfeeding challenges and baby crying and blah, blah, blah. So it was stressful. So then he didn't pass stool for about 24 hours. And I remember we even called HealthLink and we were like, oh my goodness, is this a problem? Like, what should we do? Because we didn't know, we're first-time parents. And so for him, that experience showed him that at that time, he may not have known exactly what the difference was between breast milk and formula, but he did see that formula responded very differently. Our son responded very differently to it than breast milk. I didn't really have to say a whole lot. He understood that it was different. And then it was easier for us to have those conversations about it. And so, of course, I talked about it all the time, and he's completely...
he's on board. Have you heard that Phoenix, Arizona is blessed with an amazing birthing center? Baby Moon Inn Birth Center is the best option for families who want access to midwifery care in and out of a hospital setting. You can experience birth in a comfortable home-like setting where natural birth is the focus. Laboring in water, being able to walk outside during labor, and enjoy the beautiful garden. This is what birth can be like for you. There is so much more to learn about Baby Moon. The staff would love to have the opportunity to meet you and would like to extend an invitation for you to attend a free Choices in Childbirth class and a tour of the birth center. All you need to do is call 602-314-7755. That's 602-314-7755 and ask for the tour dates. You can also go to allaboutbreastfeeding.biz/podcast. And on the right-hand side of the page, you will see a link that will bring you to the calendar, and you can sign up for the tour yourself. When you come in for the tour, Make sure that you tell them you found out about it from the All About Breastfeeding podcast, and you will be given a very lovely free gift. Now, back to the show. What I'd like to know is, because, we talk a lot about the difficulties, and you certainly had yours, a baby that's tongue-tied. You start off really difficult, but you do get to that sweet spot. And I'd love for you to talk to us about when you got to the point where it wasn't hurting, it was fairly easy, and at a certain point it becomes really enjoyable and it becomes convenient. Talk to me about when breastfeeding got to that point and to what degree you enjoyed breastfeeding.
That's a really great point too. And I think that this is why a lot of women don't hear the bad stuff, because you have way more time in the sweet spot than you do in the acute phase. And so after he had the tongue tie release, like I said, it wasn't 100% right away, but it was never as bad as it was. That was the worst. And then the tongue tie release did help. And then it kept kind of getting better from there. So some days might have been harder or better. And so I would say, it's hard to remember now, but from what I remember, it was probably about 4 to 8 weeks in, because it still took a little bit of time before it just really got easy. And after that point, and then there's a point a little later on when your baby can latch themselves. And I don't know exactly what age that is, and I think when you have a newborn and it's your first time breastfeeding, you can't even imagine the time that they can latch themselves. There's this magical point where they can latch themselves. And then there's this magical point, if you are really tired or whatever in the middle of the night, you can pull your baby into bed, lay on your side, and then your baby just latches themselves and you can just sleep while they breastfeed, and they can stay on there as long as you want. And you're not even aware because you're sleeping. So I think maybe that's somewhere between 2 and 3 months in, when what you're saying about convenient. Yeah, I love that. I love that I can pull babies into bed. I don't necessarily co-sleep all the time. That both my sons, they have their own room at some point. We keep them in the room for a while, and then eventually they go into their room. But yeah, it's tiring sometimes. And so that's one of the convenience factors that's so great about breastfeeding. As a mom who I didn't really use bottles a whole lot, and it's the convenience thing. So much easier just to throw the baby on the breast than to actually pump, put stuff there, get it ready. The convenience is something I take for granted.
Yeah, well, I think that is it, because I've certainly worked with mothers who were able to breastfeed their first baby, and then for whatever circumstances were, maybe their second baby was a 28 premature baby and they're pumping and bottle feeding, or the second baby had other health issues and they weren't able to. But you take a mom who has been breastfeeding, and even if it was difficult in the beginning, or if it wasn't, there's even if it's not difficult in the beginning, you don't have a baby with tie or you're not having pain, it still takes most mothers, especially first-time mothers, quite a few weeks until they're in that, what I call breastfeeding zone. It's easy. It's convenient. You're not thinking about breastfeeding anymore. Your baby's hungry. You just kind of pop them on. You don't have to get the pillows and the stools, and you're just able to, you take your baby boob and go. You don't realize it until you don't know what you got till it's gone. So when moms have a second baby and then they're put in the position of pumping and bottle feeding, when they've had the convenience of the first, then they realize exactly how convenient it was. And I don't want to say they took it for granted. That was just their life and they didn't really know any different. And yeah, they knew that it was convenient, but they didn't really realize how convenient until they have to go through pumping and bottle feeding and everything that requires, which is a ton of work. I'm in awe of moms who do that. But then they realize, wow, that was so incredibly convenient. And this is a lot of work.
Well, and I'm guessing that you asked that question because for some reason in our society, everyone seems to think that bottle feeding is super convenient. And it isn't. So this time around, so my son he just turned 1. So my youngest, so I had 2. This time around, I had the other one, I had a 3-year-old and a baby. My youngest has never really taken milk from a bottle. We tried a couple times, but not enough to actually form a habit. So he literally, I don't know, we never did the bottle thing. So now he's old enough to drink from a straw. And so we've introduced, other things for him, obviously, because he's 1. But yeah, my friends would be like, oh, so why don't you just pump and whatever so that she can do what you need to do, whatever. And it's hard to explain that me taking out my pumping machine and sterilizing it and actually sitting down for 20 minutes and pumping milk so that I can put it in the fridge so that I can feed my child when I could just put him on the breast. Yeah, it's not happening, especially with 2 kids. So much more convenient.
And that's the thing is you've got to a point where you've been able to enjoy the convenience. And I think sometimes there are personal issues why sometimes their baby can't breastfeed and they still want to provide milk. And sometimes what happens is that the early days of breastfeeding is so hard. To use your circumstance, for instance, there may have been totally undiagnosed tongue tie and all their experience was all pain. And so you take that mom and you start having her pump and bottle feed. Well, for her, that's a whole lot easier. And it's more convenient because maybe she was spending literally hours trying to breastfeed a baby that was tongue-tied, and it was very painful. So nothing about that is enjoyable or easy or convenient. She gets on a routine of pumping every 3 hours for 15 to 20 minutes. And from her perspective, now it's easier. We all come from these different perspectives. So while I'm totally in agreement with you that when it's easy, it's convenient, and why would you want to pump and bottle feed if you didn't have to? There are some moms that either want to, or from where the pace where they're coming from, then that's easier.
Well, let me throw in there that that was my experience with my second child. So my eldest son, when I went back to work, so in Canada, we have, if you're employed and you pay a certain amount into what we call employment insurance, you are entitled to maternity leave for up to a year. So the reason I'm saying that is because then when I went back to work, a year after I had my eldest son, so he was a year old, I continued to pump. And so I was like a little pumping soldier. So I would, on my drive to work, I hooked myself up to my double pump. I bought all these batteries. And so I had the battery pack hooked up to it, my Medela pump. And I would literally pump on the drive to work. And then I would pump once at work. And then I would pump again on the drive home. And I continued that for like 4 to 6 months or something. Yeah. So I was a soldier. So what you're saying about convenience, I'm the same human being. In one circumstance, I was completely open and I just really wanted him to have the milk from me. I wanted to kind of do the best I could. It was hard going back to work. It was hard being away from him. So that was kind of my thing. And so I was devoted to the cause. That scenario isn't going to happen this time because it's no longer convenient for me to do that.
And the thing is that you had that perspective of just the ease of breastfeeding, and now you're having to hook yourself up to the pump. I work with a lot of mothers who pump while they're driving, and now this is going to freak out some moms who, if you're pregnant and haven't gotten to that point yet, you cannot conceive of the idea of pumping. And I know they're having this visualization of their breasts out, driving down the highway, pumping, hooked up. But doesn't have to be that way. There's hands-free bras. You can cover everything while you're pumping. But to me, that's the ultimate in multitasking, and many moms do it, right?
Yeah.
But you were probably, well, I don't know. I shouldn't say you were probably, but some women do get pissy about that whole thing because you may not be ready to go back to work. You're missing your babe. And now you're kind of pissy, like about this pumping you have to do. You want your baby to have your milk and you're willing to do it. But you're coming from the incredible convenience of just popping your baby on and going for it. And now you're relegated to pumping.
Well, in my case, it was definitely like a choice. So I chose to do it and I just made it happen. I didn't do it with kind of resentment. He was a year old, so I could have put him on regular milk. But we tried a bunch of different things and we encountered a few different struggles or challenges, I guess you could say. I bought organic milk for him and then I even found like sheep milk for him and stuff. And we would give it to him and his nose ran for like a year. So he just didn't seem to it just didn't work. We tried all these different types of milk. And so now we've kind of gone in a different direction and we actually get our milk from a local farm and it's been pasteurized. So it's cow to table and the cows are on a pasture. It's like out of a storybook. But for some reason that milk is fine. So part of it was that I couldn't find something that he didn't react to. And so that's part of the reason I chose to do that. And I didn't have a bunch of negative feelings about it because it was a choice. I didn't have to do that. I could have given him milk I could have, but I chose to because we were having a hard time finding something that wasn't making his nose run all the time.
I want to switch to something because I want to get to talk about you and your work and your podcast, and I don't know if you're comfortable saying so, but there's a lot of questions that moms have. And I know that you know this, that all our bodies are different. We don't fit into a little text box like they kind of do in that 5th or 6th grade program when they teach us about our menstrual cycles. But a lot of women still feel like their body should have a very specific response to getting back their cycles when they're a breastfeeding mom. So there's so much that we could do with this, but I'm just curious to know if you're willing to share when your cycle came back with your first and if it's come back with your second yet.
Sure. Yeah, no, that's a huge topic, of course, in the work that I do. So with my eldest son, then my cycle did not come back for a year. And so around the 12-month mark, I had a period, and then I didn't have one again for about 2 months. And so at 14 months postpartum is when my cycles returned with regularity. And I continued to breastfeed and pump, as we talked about, but I continued to breastfeed him until he was about, say, 2.5. And then with my youngest son, my cycles just returned. So I just had a period about a couple weeks ago. So again, about a year before I ovulated, because since I'm a fertility awareness educator, it wasn't just that my period came back. I actually saw and noticed that I ovulated, and then I got my period.
Okay, so I wanted to talk about that. And well, I should say we don't have a lot of time to talk about that. And you might not know it offhand because you've done 100 shows, Lisa. Is there a show that you did do, a particular episode that you can look up later if you don't remember exactly, about talking about periods, getting your cycle back, and learning about when you start ovulating so you can start using that as a reliable method when moms are thinking about, I'm not ready to have a baby yet?
Well, I did do one episode. I'm looking it up here. I think it was episode number 13. Yes, 13. And I know that because I just released my 100th episode and I just went through all my podcasts and blah, blah, blah. So it's not like I have them all on the top of my head. But I did an episode. It was episode number 13 with a fellow fertility educator. And her name is Justina Thompson of Nourish Fertility. And so we talked a little bit about that. And so there's a lot of misconceptions around breastfeeding. You know, some women think that if you breastfeed, then that means that you cannot get pregnant. And other women believe that it doesn't matter. But there's a lot more to it than that. I mean, there is what's called the lactation amenorrhea method of birth control that is dependent on ecological breastfeeding. Is that something that you've talked about on the show, that the concept of ecological breastfeeding?
No, I haven't yet. And when you talk about, the whole business of some women thinking that if they're exclusively breastfeeding, that they can't get pregnant. And years ago when I was teaching classes in the hospital, they had those slides in there. And I would argue all the time with my boss that I wanted to remove that slide because what they wanted me to talk about was not what the truth was. And to me, I say the truth. To them, they just thought it was a fact.
Which part? That you could or that you couldn't?
That you couldn't. And So I know that that's poor information and dangerous information if women are walking around thinking that. So I was not able to successfully get the slide out of the presentation. So what I did was at a certain point, my concession was I left the slide in and then I talked about why it wasn't true.
Well, and so the interesting thing is that there has to be, so first of all, like the fertility awareness method, it's a whole method that involves actually observing your cycles and observing what's happening with your mucus and all that stuff. So it's not enough to just say you can or you can't. Part of the problem is that so if a woman is what they call ecologically breastfeeding, meaning that the baby is only getting milk exclusively from mom and not even her milk in a bottle, but only from the breast, and the baby's fully also kind of attached to mom as much as possible, getting lots of skin to skin contact, sleeping with the mom. There's all of these different factors in there. There is some truth to it that the first 56 days postpartum if she is doing this exclusive ecological breastfeeding and there's all of these things around it. And as a fertility awareness educator, I would add that she would also have to be charting her cycles and monitoring. So there is a way to use the fertility awareness method and use it accurately as a method of birth control while you're breastfeeding. And then there's a way to be able to identify when your fertility returns. But I think the problem is that a woman does need support, and she does need to learn the method and understand how to read her mucus, and she has to actually be looking at it, looking for it. So it's not just like, oh, I'm breastfeeding, so I can't get pregnant, because that's not true. There's all these other factors.
Right. And here's the thing is that the slide just made this blanket statement.
That's a problem.
Yes, that's a big problem. And I wanted to add all the things that you just mentioned. Plus, the other big issue that I have with that is that it talks about what I really want to say is the reality is that 85% of women are initiating breastfeeding, but by the 3-month mark, less than 30% are exclusively breastfeeding.
Yes.
So when we have that and we make a blanket statement, there are women who are breastfeeding, but not exclusively. They're pumping, bottle feeding, pacifiers, formula. They're spreading out feedings. They're not Q feeding. So there's just so much to it. And then, of course, they're not tracking. And I don't have time to go into all of that, but that is why my concession was to leave that slide up there. And I would tell them that it is not true. It's a lot more involved in it, that it is reliable, but that I wanted them to come and talk to me afterwards privately, and I would talk to them about it. I think that's just such poor information, because if you tell a woman if she's exclusively breastfeeding, first of all, she frequently during their first pregnancy, they still don't fully even understand what exclusive breastfeeding is. And then they don't understand Q feeding and sleeping with your baby and not ignoring their cues, not trying to let them cry it out and extend the time in between feeding. So there's just so much that goes on. And that's why I say this statement alone is not true. There's a lot more to it. And if you're interested in learning more, I'll be happy to talk to you about it. But when you consider that group of moms that about 30% may only fit into that picture right there, then, you have 70% of moms thinking, oh, all I have to do is exclusively breastfeed my baby and I don't have to worry about birth control. Well, that's pretty scary, putting that info out there just like that.
Another kind of factor that plays into it for a woman who is not pregnant and has not just given birth, and she wants to learn how to chart her cycles as a method of birth control, studies show that it's 99.4% accurate and reliable to prevent birth control when used correctly. It's kind of challenging enough in a way for a woman to learn already. So if a woman has never used that method of birth control before, and then she decides after she has her baby that this is when she wants to start to use it, that it certainly can be done, but she definitely will need support, because as you can imagine, postpartum, your cycles are a lot different. I didn't ovulate for a year. So when you're tracking that, I've been doing it for so long, I already know what to look for. I already know what my mucus looks like, and I already know what different types of mucus look like. And so I can interpret that. But if you've never even started and then you choose the breastfeeding time to start, it's a challenging time to start, and you definitely need support.
Yeah, Lisa, actually, I'm glad you brought that up, because I've listened to quite a few of your shows recently from the last 2 or 3 weeks. I may be mixing it up with the last 2 shows that I've listened to that you've done, your 100th show, and you've done 2 shows like that, and you brought in clips from different guests. And one of the things that really resonated with me is that if it's something that you're interested in, why don't you just start charting yourself now, even when you think it might be somewhat unreliable? Because then when you get to the point of wanting to be able to utilize this, you've now gotten past the point and it's become a habit and you're more comfortable with it, so that when you get to that point, like, you don't want to just start off and say, now I want this reliable method. It's nice to get a few months lead time in there, so you're more comfortable even doing so. You've made it a habit of checking every day and charting and then when you're really serious about it, there's a lot about the charting that's very familiar. You're in the habit, and now you're serious about utilizing it perhaps for fertility. And the other thing I loved about your show, which it was like, to me, it was like one of those like, oh yeah, moments, like when we talk about charting it, it's not just for fertility. We often think it's about, do I want to conceive or don't? And that's why you use the method, but there's so much more to it. And there's a lot of health issues surrounding it. Man, I just love your show so much. It just even opened up so many doors for me. And I'm like I said, I'm copying and sharing these so that my daughters can listen to it.
Oh, thank you so much. Yeah, that quote is Amy Sedgwick. She's of the Red Tent Sisters. If anyone's heard of them, Google them now because they are awesome. So she was talking about just for women who are really nervous about whether or not the method could work for them to kind of start getting in the habit of charting. And that really speaks to the way that we are taught as women. When it comes down to it, we're taught that we're fertile every day, which isn't true. It's actually men. Men are the ones that have the semen every day. And women, we are only fertile about 5 to 7 days in a cycle. And so when we're taught that we could get pregnant on any single day of our cycle, then it creates a fear in all of us, a fear that we could just get pregnant. And that fear stays with women for years. And so a woman who starts on the birth control pill, for example, at age 16, and then continues to be on it until she's 33, she still has that same fear that she could get pregnant at any time. And so the thought of going off the pill, she thinks that she'll get pregnant that day. And a lot of women find that it turns out that it's a lot harder to get pregnant, or at least it can be, than we were all told. Because what we're not taught as well is our fertility changes. So at 18, you have it typically, your fertility might be a bit different than what it is at 35, especially if you've been on the hormonal contraceptives for 15 years.
Right. You're expecting to, okay, it's June. I want to get pregnant in September. So now I'm going to go off the pill. And then you find out it's 6 months, it's a year. It takes time. And I wouldn't say that I'm smart about all this, but it does take, for some women, a fair amount of women, a while for their bodies to figure out what it's supposed to do again, and for their hormones to get in check again. And for some women, it could be 2 or 3 years. And what that puts them into is a cycle of feeling like they're infertile now, and then going to fertility specialists when it's really just their body. Everything has been suppressed for the last 10, 12, 15, 18 years. And it could take them a few years to get things back in sync until they are ready to naturally conceive, right?
Well, and for some women, having the basic knowledge of how their cycle works and the understanding of their fertile window, so understanding that there are only say 5 to 7 days in your cycle where you're capable of getting pregnant, being able to identify which days those are, the days that you have cervical mucus. So whatever that looks like, peak type cervical mucus is clear, stretchy, slippery, but understanding that when you have that type of mucus, I don't like the word discharge, but if I say discharge, everyone knows what that is. So the days that you have that observation are correlated with your fertility. So for some women, just having that knowledge is enough to help them conceive, even if they've been trying to conceive for a really long time. Because another thing that we're all told is that all of our cycles should always be 28 days, and that's what's normal. And we're told that we ovulate on day 14. And so there's a lot of women out there who have sex on day 14 of their cycle all the time. And because their cycles are not 28 days, they end up missing their window every single cycle. I mean, can you imagine? And so then learning this information and actually being able to figure out when they have mucus and timing sex based on that. Some women, not all women, because obviously there's fertility issues that some women face that are beyond just this basic knowledge. But for some women, that one shift can cause them to conceive.
Exactly. My takeaway on this part of the conversation is that for most women, charting their cycles and cervical mucus is actually quite easy once they get into the sync of it. And it's also we get a little crazy because we're like, well, the pill is 95% effective. But charting and knowing your own cycles, that's, what did you say, closer to 99%?
99.4 with perfect use, which isn't hard. You just have to be taught from an educator really to have that high effectiveness, but it's completely doable. And it's pretty much the only method of birth control I've used for the past 15 years. And interestingly enough, then the only time I wasn't using the method for birth control is when we were trying to conceive our two children. So they were kind of like right on schedule.
One question that I wanted to ask you, and this came from the clips, so I didn't have time to go back and find the original show, but one of your guests was mentioned, did she say a Chinese condom? Did I hear that?
Oh, Japanese condoms. That was Holly. I'm trying to like mock her accent because she's so cute. That was my interview that I did with Holly Griggs-Spall. That's interview episode number 21. And so she wrote a book called Sweetening the Pill. And it basically outlines not only her experiences, but the experiences of many women on the pill. It's kind of like the dark side of the pill that no one talks about. The fact that the pill is associated with increased rates of depression, anxiety, panic attacks, and just general craziness. She talks in the interview about how she kind of thought that it was just her having these weird, intrusive thoughts. And then she went on forums of women who were on the same type of pill that she was on. It was Yaz that she was talking about. All of these women had eerily similar experiences with regards to anxiety, panic attacks, and these weird, intrusive kind of crazy thoughts like, oh my gosh, my boyfriend is probably dead right now, or just like that kind of stuff is really random and crazy. And so you just think you're a nut until you find out that all these women have it. So anyway, side note. So in that interview, she talked about Japanese condoms. So she gave the example of in Japan, I think they're just not really big on hormonal contraceptives in general. And so the most popular form of birth control is the condom. And because it is the most popular form of birth control, they make really good condoms. And so that's why she said that.
That's the impression that I got, that there was something special about the Japanese condoms. Yeah. And then my curiosity was, well, what's so special about their condoms? So
they're really thin, and so they are more pleasurable for both parties. And that's because they have created that technology. So if the majority of the population use them, then it just so happens that they're going to make them better. And so that's why she was talking about. So I think she said, get yourself some good Japanese condoms, go off the pill, and sort out what's going on with your cycles. Well, and she talks in her book, she talks about another company called They Fit Condoms. And it's a really interesting company. So definitely Google that if this conversation interests you, or if you've ever had an issue with condoms not fitting properly or not being comfortable. So this company, I don't, off the top of my head, I don't remember, but they have like 60 different size combinations. So you can have like the width bigger or smaller, or the length bigger or smaller. And you can literally have your male partner measure his penis and get a condom that is a corresponding size that would actually fit his girth and length comfortably. What a concept.
Whoa, baby. What's the name of this one again?
They Fit Condoms. They, like the word they, and fit.
So what's funny is right now, some people have tuned into my show who usually talk about breastfeeding, especially the moms who have just never even had a baby yet. They're
and now we're talking about condoms.
Okay. We're talking about they fit, measure the size, girth. They can get this really great fit.
A lot of women who are listening to your show have probably just had babies and are actually thinking about birth control. And I wouldn't, like, when I became a mom, I was so concerned. I became a little bit crazy. Like, what am I putting in my body? What am I putting on my child? Like, I went through a whole household cleanup where I got rid of all of the products that had the scents and, changed the laundry detergent and all that kind of stuff. So a lot of women, I'm sure, are curious, like, if I need birth control and I start taking the pill, is some of that going into my baby? Yes, it is.
Yeah, so thanks for bringing that full circle. And I want to take it even a little bit more because I really want my audience to hear a little bit about the programs that you offer. And I don't know if you're still in the midst of it, but I know you've done a program called the Fertility Boost Group Program.
Yeah, in the middle of that.
What is some of the work that you are doing that you feel would be interest to my audience? Like, why would they want to get in touch with you?
Well, if this conversation has piqued the interest of any mom who is breastfeeding and is concerned about birth control, her birth control options, especially for women who didn't particularly have a positive experience on hormonal birth control and are wanting to learn how to figure all of this out. So the programs that I offer, I'm a certified fertility awareness educator. And what that means is that I teach women how to chart their cycles, how to use that understanding about their cycles as birth control. So to teach you how to identify which days of your cycle you can actually get pregnant and which days you can't, so that you can use that as a method of birth control. So if you have sex on the days that you can't get pregnant, you can't get pregnant. And so it's an effective method. And so that's a big part of what I do. And of course, for women who are struggling to get pregnant or for women who are trying to conceive, the method then works in the opposite way, in a sense, where you can identify the days that you're most likely to get pregnant. But like you said, Lori, it goes much beyond that, because one of the things that I teach and one of the things that I always talk about on my podcast is that a woman's menstrual cycle is actually the fifth vital sign of her overall health. And so just like if you go to a doctor's office and they test your blood pressure and your heart rate, and it will tell them something important about your health, if a woman's menstrual cycle is off or outside of the normal parameters or generally unhealthy or really irregular, or if she's not ovulating, or if her luteal phase is really short, like the second half after she ovulates, the second half of her cycle, these things show so much about her health. And so part of what I do is I help women to identify if there are certain things that do need to be looked into deeper, and help women to give them the tools to improve the health of their cycles naturally. And so that's what I do in my programs, and that's what I do in my work with women. So if you're breastfeeding and you know that you don't do well on the hormones, and you're looking for another method of birth control that you can trust, but maybe you've heard of fertility awareness and you're not really sure how it all works, that's something that I do. You can actually use it as an effective method, and you can use it throughout all the different parts of your life, but you can certainly use it postpartum specifically. But you do need some support to figure it all out in postpartum, because it can be a little tricky, especially if you've never used it before. That's a long-winded answer. Sorry.
It's all great. And you've explained it all really well. One of the parts that I also really like about, I brought it up a little and you just expanded on it a little bit more, but I just think is of such interest for people to think about, is that it would be really helpful to work with you. Because, if you're interested, like you said, if this sparked an interest and you're looking to not take those hormones, but even just take that a step further, is that if you're having problems with infertility, you may be able to trick your body with other medications and other hormones to conceive, and then other hormones to maintain a pregnancy. But one of the big take-home messages that I wanted to get out there, you shouldn't stop just there in trying to conceive, that you really need to understand that there's a sign of something else wrong, and that in addition to maybe just conceiving, you want to think, why am I having such a problem? And I really want to get to I want to figure out why I'm having a problem, and infertility is a sign of something else going on with your system. And you should want to learn more about your body for overall health reasons, in addition to conception.
Well, it's just like what you said about breastfeeding, that it shouldn't hurt. So if it hurts, it's a sign of a problem. So in the same analogy, your periods shouldn't hurt. Although it's very common for women to have painful menstruation, for example, it is actually not normal, and it is telling you that there's a problem. There's a lot of aspects of it, but there is a such thing as a healthy menstrual cycle, and there are parameters for a healthy menstrual cycle. And so if your cycle is consistently falling outside of that, or you're having issues like you're not ovulating, that is an indication of a bigger problem that is not specific to your fertility. It's an issue of a bigger problem that's underlying that is affecting your fertility.
And the other piece to that I just wanted to add on is that when it comes to terms with breastfeeding, women can trick their body into conceiving and keeping a pregnancy. But if they were lacking certain hormones in balance, or other things in their body are out of balance, some women have a problem with making enough milk for their babies. So they were able to trick everything and have their baby, but now everybody's kind of scratching their heads and figuring out why they're having a problem making enough milk is because the underlying problem was not really addressed.
I could do a whole show on that too, because then when your focus is only, I want to get pregnant, and it's not, I want to support my body to have the proper hormone levels. It's not, I want to make sure that I give my body proper nutrients and the proper nutrition so that I have a healthy baby and a healthy pregnancy. I always joke that nothing sucks the nutrients out of your body like a child. If you're pregnant, it's going to suck all of those nutrients out of your body. And then that can leave you really depleted postpartum. If your hormone levels are a hot mess, then postpartum can be really, really hard. And postpartum depression is associated with really low progesterone levels, meaning your body's struggling to produce the hormones just that it needs, let alone in abundance, but just to produce what it needs. So you're exactly right, Lori, that if those issues are not addressed, it can cause big problems later on. And when a woman is struggling to get pregnant, she's not thinking about postpartum and what that's going to be like.
She just wants to get pregnant.
Yeah, but postpartum will come. And for some women, it's not a positive experience.
So I want to come back to your podcast. It's called Fertility Friday. And it literally, I love the name for so many reasons. And it comes out on Friday, right?
Yeah.
So as we're coming to an end here, what is something that you wanted to share with my listeners about breastfeeding, your experience, and or any words of wisdom, and or something about the work that you're doing in the podcast that you're providing for us? What would you like for us to know about either?
Well, in terms of breastfeeding, I would say that if you do have difficulties and challenges, think what I would want to know. I would say that, I guess, stay true to yourself. Don't try to do something because you think you should or because you think you shouldn't or whatever. Just, do what's right for you in those moments. You'll know what that is. And sometimes that means that you're going to keep going. And sometimes it means that you're not. I hope that you're able to get the support that you need to keep going. But yeah, sometimes it means that you're not. Sometimes it means that you can't. I don't know if that's very helpful to the women out there, but I had a lot of judgment around it before I experienced it myself. And now I don't have a whole lot of judgment to offer because it can be really hard. In terms of the podcast, if you're intrigued by the conversation we have today, like Lori mentioned, I have released my 100th episode. Part 2 came out today. I was really excited about that. So there's tons of information. So it's just the tip of the iceberg. It'll blow your mind if you've never heard of this before. If this is the first time that you've heard that women can only get pregnant on 5 days of their cycle, then just, head over to fertilityfriday.com to have your mind blown.
Hey, that's a good tagline. Head over to Fertility Friday to have your mind blown.
Yeah.
Can I steal that for me? Head over to All About Breastfeeding to have your mind blown.
Totally. It's yours.
Well, Lisa, thank you so much. I know that we went over and it's late in the evening for you. And I'm sure someone there is watching your kiddo, probably your husband watching your kiddos. Maybe they're sleeping at this point. I don't know. But you have definitely gone over and above in sharing your time with us. And it has allowed me to have my audience hear some of your expertise in the field of fertility, talk about your podcast. Of course, we got into a lot of other fun stuff too. And I just want you to know that I appreciate your time and energy. Thank you so much, Lisa.
Well, thank you so much for having me, Lori. It was a lot of fun getting to chat with you. And I'm looking forward to having you on my show to talk about breastfeeding very soon.
Yeah, I know. We're going to do this sharing of things.
Yeah, it's going to be fun.
One last thing. Can you just tell us if there's one way that our listeners could get in touch with you?
I would say go to fertilityfriday.com and click on Work With Me. And yeah, you can grab that information there. And if you want to email me, you can just email me at info@fertilityfriday.com.
Perfect. Thank you so much, Lisa.
Thanks so much, Lori.
Before we say goodbye for the day, I would like to invite you to head on over to allaboutbreastfeeding.biz to get your free copy of my best tips for pumping and storing milk.